Hi everyone, I'm Dr. David Bernstein and I wanted to welcome you back to our series 25 Tips for Working with Modes. Okay, now last time we started with tip number 1, which is observe. That means just observe the mode that is active right now in the therapy session or on a ward. Which mode is it that I'm dealing with? And just pay attention, observe which mode is in front of you, and pay special attention to those nonverbal emotional cues that give you some hints about which mode it is. And we also noticed last time that dealing with modes can be stressful, it can be challenging, and especially if you're in the heat of the moment. And how do you deal with that? And that brings us to tip number 2, which is slow things down. Now, that may seem paradoxical. Here you've got a heavy-duty mode, here in the room with you, and I'm saying slow things down. Why is that? Well, because you need to slow things down. You need to buy yourself a little bit of time, even a few seconds, to take in what's happening, to be able to observe and process the information about what's happening in the situation with the patient so that you can make some good decisions about how to deal with it. Now let's take an example. Imagine that you're with this mode in the room. This is the anger protector mode. This is the mode that we met last time. And this is a mode that emanates a kind of nonverbal hostility or anger and sends a very clear nonverbal message, stay away from me, I don't trust you. How's it going to be for you, when you're in the therapy room or out on a ward and you encounter this mode? What are you going to feel in that situation? How's it going to be for you? Well, even though we may not always realize it, but patients' modes can put us under stress. And when that happens, we can sometimes unconsciously flip into modes ourselves. Now, which mode that is, depends on who you are, depends on your own personal makeup and what your life experiences are, what happened to you in your past, the painful things that may have happened, the wounds that you have, and the sides of yourself, the modes that you developed in order to cope with those early life experiences. Now we're professionals, right? You may think, well, I shouldn't have modes. I should be above that. Well, I'm sorry, but you're a human being. We're all human beings. And so sometimes, especially when we're dealing with, patients who have extreme modes, it can push us out of our comfort zones. And then we can flip into modes too. And that can make it more difficult then for us, in that moment, because now the patient's in a mode and we're in a mode too. So let's take an example. Let's say that, I'm in a therapy room and, now I've got this guy in front of me, the anger protector, pushing me away, saying, don't come near me. How am I going to react? Well, maybe I'll flip into this mode. This is a mode aside of myself. It's a lonely child mode. I have a lonely child mode, from my own life experiences. And, when this gets triggered, it's painful. And again, I'm a professional and so forth, but it doesn't mean I don't have this side of me. And so maybe in the heat of the moment, in confronting this patient who's basically saying, stay away from me, maybe this side of me gets triggered. And, that's difficult to deal with. So what can I do? Well, what I'm recommending here is to try to just be aware of and accept your own experience. You're allowed to have modes too. We're allowed to have our own reactions. So as much as possible, just try to be aware of what's happening in your body and in your emotions, in that heat of the moment. Just try to pay some attention to yourself and ask yourself the question, could it be that I'm in a mode right now? And if so, which mode is it? If you have some knowledge about your modes, it helps, of course. And then, as much as possible, try to accept that mode. And, just say, hey, this is a side of me, So, what I'm recommending is, to accept your mode and then, park it on the side. And so how does that work? It's kind of like saying, hey, David, I know that this side of you is here right now, your lonely side. And it's okay, I understand why this side of you has gotten triggered right now. I recognize you. And you can stay here. I know it hurts, it's difficult, but you can stay here with me. But now I'm going to park you on the side. I'm going to just move this side of me to my periphery. You can stay here with me. But now, instead of being the center of my attention, I'm just moving you to the side. You can stay here, but now you're in the periphery of my attention. And now I'm going to return my attention to the patient, because, yeah, okay, lonely side of David, you can stay here, but I have some work to do right now. Now, what I've just described is a process, that I call the ORI Circle. The ORI Circle is a very simple method that, helps therapists or people on wards, when their modes are getting triggered. And how does it work? Well, you start by observing the patient's mode, right? We just talked about that. That's the beginning. What mode do I have here, in front of me? And then pay attention to yourself. That's step number 2. Reflect. What does this do to me? What's my reaction to the patient's mode? What am I feeling right now? And is it possible that now I have, flipped into a mode myself, and now that mode is kind of dominating, how I'm experiencing things and how I'm reacting? And then the second R in the ORI Circle is recruit. Recruit your healthy adult mode. We're therapists, but we're human beings too. And what do you need in this situation? Maybe you need some, self-compassion for the, the pain of that lonely child that's being triggered, or maybe just some to reassure yourself and let yourself know, hey, everything's okay, or I'm okay. Whatever you need to do, just, give yourself some of what you need in that moment. And then once you've done that, then it's much easier to kind of accept your mode and then park it on the side. And then return your attention to the patient's mode, because, that's the, starting point for intervening is, what mode do I have here in front of me? And, when you know which mode you're dealing with, then you can choose which intervention. Okay, so what I'm suggesting is that, these are crucial steps that, it's, we can talk about, what mode is the patient in and what should you do, which technique should you use, which intervention. But the most crucial step, in my experience, is dealing with yourself, dealing with your own reactions. Okay. Now, we're going to come back to this topic of, how do you, deal with your own modes. We'll come back to that later on in the series. But for next time, I want to go back to the modes of the patient, because, knowing exactly which mode the patient is in is actually very important in terms of knowing how to intervene. And how do you make those fine distinctions between modes, because, you want to know exactly which mode you're dealing with. And so that brings us to tip number 3, which is it's in the details. Okay, so, and, just a reminder, please visit our website, www.imodes.com, and take a look at our image-based therapy tools. Okay, see you next time.